Thank you, Dr. Poonam Khetpalji, our RD for the region, all the distinguished officials at the WHO regional office in this meeting right now, all my colleague health ministers of the region and their health officials from all the countries. Thank you, Dr. Poonam, for giving us this opportunity of presenting before the regional colleagues the challenges that we faced during the last 6 months, and more particularly about the treatment that we gave to the non-COVID facilities also. Before I say, I would also like to join you in congratulating and conveying my best wishes to the Health Minister of Indonesia on his birthday today, and also my good wishes to all our colleague ministers and our friends in WHO. Well, you will all appreciate that in India we are into the 7th month of the pandemic, and of course in the world it's almost the 8th month we have already entered since our last case we had on 30th of January. And in a country as vast as 1.35 billion population, it's very difficult to describe these challenges within a couple of minutes. But still I will run through a few slides so that the colleagues in the region can have a fair idea of what we could do, how we are progressing well, and what are the challenges that we still continue to have. So I start with this first slide. Can you go to the next slide, please? So this is the slide which in fact shows that on the 7th of March, China had identified this new type of coronavirus as a causative agent for the pneumonia-like cases. And you can appreciate in this slide that India recognized the need for a prompt response to the situation and initiated with the first joint monitoring group meeting on 8th of March to monitor the situation. Next slide. This slide in fact shows that India's response was based on the past learnings of the various outbreaks and the epidemic situations, and the experience that we gained in these various disease outbreaks during the last 2 decades, particularly in terms of our containment strategies. The whole of government approach was built on to respond to COVID-19 pandemic also, like we had done in the past. Next slide. This is the journey that we have shown in brief, which shows that we had a graded response with the evolving situation. India has had a graded response from the start and issued advisories and restrictions even before the first case was reported on 30th of January. We started doing all this on 17th January. The response in terms of strategies and action plans were escalated based on the extent of the spread and severity of the cases in the country. On 6th of March, you can say, although we started our screening at 4 airports on the 18th January itself, but on 6th of March, screening of all passengers started and all incoming flights were banned by 22nd March. The first partial lockdown, Janta curfew, was implemented on 22nd March, and the world's biggest, most severe lockdown was put on 25th March. The lockdown is being lifted in a staggered manner starting 1st June, yet maintaining essential social distancing measures and restrictions on mass gatherings. Can we go to the next slide? I think the previous one. This shows that we had a proactive response and started screening of travelers before cases were reported, and a complete lockdown at a total of 657 cases. We started screening at our borders, 12 major and 65 non-major seaports, at integrated checkposts and all international airports. Next. This again shows that we have had a multi-level institutional response with a whole of government approach led by our Honorable Prime Minister. Various ministerial groups, expert committees and forces have been formed that are consistently monitoring and reviewing the situation, developing strategies, guiding and providing hand-holding support for the on-field implementation of the action plan. You can see in this slide that the group of ministers headed by me, we held 19 meetings till now. Then the committee of secretaries headed by the cabinet secretary held 51 meetings, and similarly 37 meetings of the joint monitoring group. And at every level, even at the level of the health ministry headed by the health secretary, there were 58 review meetings till now. So it's a detailed response at every level, monitoring at the highest level. Next slide. This is again showing that there was a simultaneous focus on every aspect of handling the pandemic, improving our core capacities and giving attention to all aspects, mainly focusing on surveillance, testing, containment and clinical management of the cases. Can we go to the next slide? This slide shows, on the left side you will be able to appreciate India vis-a-vis other most affected countries has a very high population density and less support in terms of GDP expenditure on healthcare, beds and doctors availability. And on the right, extreme right, you can see, yet we have been able to control our population, standardized cases and deaths due to COVID well below other countries. It gives you a comparison of cases per million and deaths per million. This is another slide which shows that how the lockdown helped us. The early lockdown enabled the country in many ways. While the growth rate during the initial phases was as high as 36% before the lockdown, it came down drastically and has been consistently decreasing even after the lifting of the lockdown. Next slide. Then this is how we built up our infrastructure during the course of the lockdown. The other gains of the lockdown were the utilization of that time period to quickly augment our healthcare infrastructure to support the growing number of cases. We have been able to increase our isolation beds more than 34 times and ICU beds more than 20 times. And then right now, on evaluation, we find that the daily handling capacity of COVID cases in our hospitals has increased to almost 35 times. Can we go to the next slide? This slide gives you, because WHO in fact all the time was saying tests and tests. And we remember the time in the first week of March when we were doing just about 6,000 tests a day. So we have been focusing on testing to detect cases as early as possible and have done more than 20 million tests as of today. The testing capacity has been augmented to a total of 1,366 laboratories which are conducting more than 600,000 COVID tests daily in the country right now. And it would be pertinent to mention that we have started our journey from one lab in the country, and right now we are at 1,366 laboratories all across the country. And in a country as vast as India, within 3 hours, a person can reach a lab, 3 hours travel time anywhere in the country. Then the next slide is, it shows that 33 states and UTs in the country, they exceed the WHO norm of 140 tests per million per day and have been continuously increasing their capacity. So it's except for 3 states and union territories, 33 out of 36 are already doing better than the prescribed norms by WHO on the testing front. Then the next slide shows that our focus has been on community surveillance and containment, and we had started all this right from 17th January itself. Our efforts in containing the spread have been around aggressive, continuous community surveillance and management of COVID cases within the containment zones. Next. This slide shows that even now our active cases are still concentrated in a few states only, and as a result of an aggressive containment strategy, though we have the third highest absolute number of cases, our cases are still concentrated in only these few states and districts. Then this is a slide which shows that how we in fact mapped our patients to various care centers. We identified a 3-tiered dedicated COVID facilities system for clinical management of the cases with both the government and the private sector participation. For the milder cases, COVID care facilities that are usually makeshift arrangements made in hostels, hotels, schools and stadiums. For moderate and severe cases, COVID care health centers and hospitals with ICU and other life support systems in place. So this worked very well and is helping us a lot in handling the COVID situation. Then the next slide. This slide shows that within 10 to 12 days, we were able to create these big facilities with the support of our DRDO, and these are the facilities where from 1,000 to almost 10,000 beds have been created, and they are working quite well right now. Next slide is about. This slide shows how we have been able to handhold support to health facilities for effective case management in terms of capacity building needs. State, district and facility level trainings have been undertaken for healthcare personnel on ventilator management, clinical protocols and infection prevention and management areas. Then Center of Excellence initiative is undertaken where our premier institution AIIMS New Delhi is supporting all healthcare facilities all over the country for better case management for COVID cases. Then also you can see that in contrast to the international data, the patients requiring ventilatory support and the ICU support and the oxygen support has been much below 5%. Next. Then this slide shows that overall the strategy for treatment has been to detect the cases early and provide a seamless hospitalization experience, emphasizing on saving lives and ensuring the availability of both COVID and non-COVID healthcare services to the people. Now this is another slide which shows that how the number of active cases have gradually reduced and the number of recovered cases have been gradually improving. Given our doctors and other paramedical teams, their tireless work on the field, there has been a continuous decrease in the share of active cases and a rise in the recovery cases. You can see that right now the recovered cases are almost double the number of active cases. This is I think because of the concerted efforts on the field, which has translated into these higher recovery rates. Every day the recovery rate is much better than the earlier day. Next slide. This again shows that the effective clinical management which continuously led to the decrease in the fatality rate. It has been very heartening that our fatality rate is probably the lowest in the whole world, and the recovery rate also probably the best in the world. And you can see continuously the fatality rate going down. The next slide, this slide shows that India has leveraged technology to fulfill the healthcare needs arising in the pandemic situation, providing online OPD services in lieu of the restricted movement of people, providing an online platform for training for the healthcare staff, also prediction of emerging hotspots with Arogya Setu applications Itihas data. Arogya Setu, as you know, is probably one app which has attracted the maximum number of people, not in India, but I think anywhere in the world there is no such app which got so much of attention of the society, with almost 12 to 13 crore people on the Arogya Setu app right now. Then this slide shows that with an unprecedented demand on healthcare system and an inversely impacted healthcare seeking behavior influenced by misconceptions, there was an increased need to maintain people's sense of trust in the system and to minimize the morbidities and mortalities from other non-COVID conditions. And here we can see that the healthcare system has had a synchronized focus on strategizing COVID-19 related activities along with a continuous provision of non-COVID essential services. We never lost our focus on the management of these non-COVID patients. Then this next slide shows that the strategy and the preparedness of states for ensuring the essential non-COVID services in areas such as reproductive, maternal, newborn, child and adolescent health, communicable diseases and chronic illnesses is reviewed periodically at the highest level. It was reviewed regularly by the health minister, by the health secretary, continuously, and everything relevant was mentioned to them. And later on, in fact, we posed this issue over them and wanted them to report back with detailed presentations what is being done on this. So this was monitoring at the highest level, at the central level as well as at the states level. Next. This slide again describes the strategy for the delivery of the essential services. Briefly, it is about realizing that our hospitals are dealing with a highly infectious diseases. The hospitals have been identified and clearly communicated. All the suspected and confirmed COVID cases get treated at these dedicated COVID facilities. People seeking non-COVID services or those who are unsure of their needs are treated at our healthcare centers. or are teleconsulted, and then, though clearly demarcated, both these facilities are a part of an integral approach and work in tandem to provide seamless healthcare services to the population. So this gives you a fair idea of how we worked. Then we regularly provided guidance to our federal units, provided them continuous support in terms of guidelines, reviews, and hand-holding, the field support which was being provided to the states both virtually and by teams which were visiting the states periodically and depending upon the need in relevant states. A few focus areas besides COVID have been these reproductive, maternal, newborn, child and adolescent health, vector-borne diseases, immunization services, leprosy, tuberculosis and other interventions such as blood transfusion services and safe use of protective equipments. Can we go to the next slide? Yes. We all know that this was an area which required a lot of attention during these COVID times, and realizing the psychological impact of the pandemic situation, the focus on mental health has been central to our strategy. A comprehensive approach ranging from helplines to communication materials has been undertaken to ensure mental well-being of the population. Can we go to the next slide? This slide, in fact, shows that we promoted the best practices of various states to other states, encouraged them, motivated them, publicized the best practices of the various states and shared them with the rest of the country. And this was quite a bit of success. They were utilized by others, the experience of the various states. And we created a decentralized healthcare structure and customized action plans for each state. We provided great learning opportunities across the states that we acknowledged and captured centrally for a wider distribution and replication. So then this is just to summarize that India has prioritized the availability of essential health services while simultaneously managing the COVID-19 pandemic. We are fairly satisfied with the progress that we have made during the course of the last 6 to 7 months, and we hope that with continuous support and guidance from the World Health Organization, we should be able to do much better in the coming weeks, and hope to mitigate COVID-19 situation in the near future. This is what we all wish and pray and trying our best for. On the vaccine front, I would like to add that at least at 3 places we are in a situation where the vaccine candidates are in the clinical trial stages in various phases, phase 1, 2 and even in phase 3, and we hope to contribute to the development of the vaccine initiative jointly launched by the whole world in collaboration and guidance of World Health Organization, and we are quite hopeful that India should be able to contribute significantly on the vaccine development front also in the near future times, and also then later on we having a big manufacturing capacity and capability. We are already having the potential to provide 60% of the vaccine manufacturing abilities of the whole world. So we are hopeful that India should be able to play a very significant role in helping the world in handling COVID through vaccines. So this is all about how we have been doing over the past 6 months in brief. And if there are any questions later on, we can answer them also. Once again, thanks RD Dr. Poonam Khetpal Singh and all the colleagues at WHO for giving India this opportunity. Thank you.